And with COVID hospitalizations on the rise and testing still in high demand, the county says it is ramping things up. I spoke in depth today with Public Health Officer Dr. Jennifer Chavinsky. First off, Dr. Chavinsky, we have seen hospitalizations related to COVID see a major jump recently. How are hospitals in the county doing so far, and what should people know?
Yeah, well, we are seeing a rise in hospitalizations. So we are starting to see that in some hospitals that we're seeing the beds fill up more quickly than in others. So what people should know is, the best way to prevent hospitalizations from COVID continues to be the things that we talk about, like vaccines, wearing masks, trying to remove that pressure off the hospital system so that way other people who need to come in for things like heart attacks, strokes, and other emergent needs, that we don't have a stress on the system. So with that, we're seeing a rise in hospitalizations. It's still in our older age groups, but it's something that once we see that trend, we want the community to know about that and to continue to take precaution when it comes to the spread of COVID.
If you could put these numbers into perspective for us, how does this compare to earlier in the pandemic?
Sure. So right now with our hospitalizations, we're not as high as what we were this time last year. So I think that's a sign of comfort. But at the same time, we're still seeing numbers go up from, say, around the time this summer or even around a month ago. So with that trend going up, it's something, it shows us with that we might be seeing an uptick here and that we need to take additional precautions.
Need to take additional precautions. And are the majority of hospitalizations unvaccinated people?
We still continue to see that trend. So primarily, we're seeing hospitalizations, intensive care unit stays in those that are unvaccinated. And particularly when we look at hospitalizations or intensive care unit stays for children, those are vastly over and above in those that are unvaccinated compared to vaccinated. In fact, we don't have looking back at the past number of months, not a single, fully vaccinated child in the intensive care unit. That's been really those that have not yet been vaccinated.
I also want to ask you about testing. Yesterday, the county's website did not show that testing was available in the Coachella Valley. And then this morning that changed. So what happened?
Well, we're continually working to build up our capacity in different testing sites. As we're hearing about different sites and lines that are growing, we're maneuvering in order to try and increase hours at certain testing sites. We're trying to expand the test kits that are available. So we're working consistently as part of our response to make testing available to the community broadly.
Did you anticipate this high demand?
I think, with the change in some of the protocols, with the holidays, we did anticipate that testing needs would increase. And similarly, we've been ramping up to try and meet that need. I think these are trends that we're seeing not only in the county, but really across the state and across the country.
Are you satisfied right now with where we are in terms of testing?
We're continually working to try and increase our testing abilities. And that's something we're going to continue to do as we see, return to school, as we see, that need continually being there. We're going to continually work to try and meet that need and ramp up our testing in areas that need it.
Yeah, and I also want to ask you, what are the turnaround times for these tests, and are they where you think they should be?
Yeah, so depending on what kind of test that people are using, there are, of course, we have a range of different kinds of tests that we're seeing people use in the community. The home tests that people are getting, that's rapid 15 minutes or so. There are partnering pharmacies that are doing rapid antigen tests, again, a quick turnaround. And then there are PCR tests that can take somewhere between 24 to 72 hours. And of course, that'll also depend on the amount of tests that are coming through. Again, as we work to ramp up on the testing side, also ramping up capabilities on the the side of the lab as well, to try and be able to get those results out as quick as we can.
If people cannot find a test, what should they do? And is there any way for them to tell if they have a cold or COVID without a test?
Yeah, so if you have symptoms, the message has been the same throughout the pandemic is if you have symptoms, we would like you to stay home. If you are having trouble getting a test and you're concerned about your symptoms, of course, we would want you to talk with your healthcare provider about those symptoms. It is challenging to tell the difference between the symptoms of COVID versus a cold versus allergies. So we are recommending precaution. If you have symptoms, then you're going to want to treat it as if it could be COVID and to take precaution in that way.
Is it possible for people to be infected with two COVID variants at the same time? Is there a difference in terms of symptoms between Delta and Omicron?
Yeah, so initial studies are starting to see that there might be a difference in symptoms. In particular, for Omicron, people are reporting more of a sore throat, muscle aches, in particular back aches, compared to Delta and other variants where they were reporting more of loss of smell, loss of taste, which doesn't seem to be quite as common with the Omicron variant. But studies are still looking into that a little bit further. So it can be a challenge at times to determine which variant you have, unless a specimen goes for whole genome sequencing, for instance.
And can you have both at the same time?
So right now in the county, we haven't really been seeing that. We're seeing either the Omicron or we're seeing the Delta. But I think that's something that over time we'll continue to look out for. And I think across the country and the world, looking into whether or not or how often something like that might happen.
And can you clarify in terms of quarantining, what are the guidelines here in Riverside County? And what is it for people who test positive versus people who have been exposed?
Sure. So your best guide is going to be, first off, we have protocols that we're posting on our website, but all of it is in line with CDPH. So we're, as we have throughout the response, aligning entirely with the California Department of Public Health and their guidance as well. And so if you go either to our website or if you go to the CDPH website, you can find those detailed out.
Do you happen to know what those number of days are, the quarantining?
Sure. So for those that are positive, it's shortening the timeline. This is for whether you're vaccinated or not, shortening the timeline from 10 days to 5 days. But there's a couple of really important things there. One that requires a negative test on day 5 or thereafter. So it needs to be in people that aren't experiencing symptoms or that their symptoms are resolving, getting significantly better, that they're not having a fever, and they're testing negative. Those would be the ones that would then be able to come out of quarantine. But for the remainder of time, we're still asking that they self-monitor for additional symptoms. We're still asking that they wear a good, well-fitted mask in order to prevent any potential for spread.
So those are 5 days for people who've tested positive, correct? What about people who've just been exposed to somebody who is positive?
Yeah, so it's the quarantine time is also similarly shortening from the 10 days to the 5 days, and a similar line of thinking. But again, I think the best in order to see the details of the protocols is to see them on our website or the CDPH website, because it really spells out all the different specific areas that you would have to meet in order to be able to test out at the day 5.
Anything else, Dr. Chavinsky, you'd like to say before we let you go?
I just, with the trends that we're seeing with increases in cases, with increases in hospitalizations, I do want to continue to encourage everybody to get vaccinated if you haven't yet, get your booster if you're eligible. And particularly, we're seeing lower numbers of vaccination in younger kids. So bring your kids in to get vaccinated as well, and continue to wear masks, wash hands, avoid crowds. All of the things that we've been talking about all along will help keep the community safe.
Are you concerned that the numbers will continue to spike?
I think that we might continue to see the numbers go up with the holidays just behind us, and knowing that there's likely a number of gatherings during that time. So we have to really follow those numbers closely. And again, if people have symptoms, if you have symptoms, we do recommend that you stay home and you don't expose others, so that way we can decrease the spread of disease.
All right, Dr. Chavinsky, we appreciate your time. Thanks so much for joining us.
Yeah, sure.